Oh, it says recording pending. Hang on.
How come you still have it and none of us have it? It's so weird.
Maybe mine hasn't updated. Now we're good. Recording.
There it is.
Recording the meeting.
Good morning, everyone. Thank you for coming. My name is Michael Santoro. I'm the Director of Policy, Research, and Housing Support for the Department of Housing. This is the virtual public hearing for the fiscal 20 and fiscal 22, fiscal 20 and fiscal 21 Recovery Housing Program Action Plan. HUD awarded 2 years worth of funding, but provided subsequent guidance on public participation in the creation of the action plan. This plan is due to HUD on or before August 16th. It has been open for public comment for the past week. It will be open for one additional day beyond today. But today is an opportunity to discuss the plan, take input, answer any questions that may be out there. Since we have only one member of the public, I will ask her to identify herself. I will also then ask other representatives of the department to identify themselves for the record. So, Joanna.
Okay. Can you all hear me?
Yeah.
Okay, great. So my name is Joanna Rogalski. I work as a senior regional planner at the Naugatuck Valley Council of Governments. I'm here just to kind of listen in and find out a little bit more about the plan. Full disclosure, I haven't actually read it, but we have and I intend to do that. Don't get me wrong, but we have a lot of inquiries from our municipalities about the municipal affordable housing plans, and I'm just curious how that's all tying in with what our municipalities need to do on that level.
Great, and thank you, and that's a really interesting ask, because on the surface, it's really not related to the affordable housing plan. But it can be if that is your municipality's choice. So we'll talk about the plan first, and then I'll attempt to answer any questions related to the affordable housing plan requirements of municipalities. So really quick, the Recovery Housing Program, or RHP, was announced by the federal government. It is intended to create opportunities for transitional housing for people in recovery. There are specific requirements and set-asides in coordination with the local continuum of care. There are 2 continuum of care here in the state of Connecticut, Open Doors Fairfield County and Continuum of Care Balance Estate. We have consulted with both of those groups in the preparation of this plan. And as the plan talks about, we intend to target 2 activities. 1, specifically dealing with the creation of sober houses or their equivalent, and 2, transitional housing in association with the Court Support Services Division of the Judicial Branch for the state of Connecticut. Those are individuals coming out of correctional facilities or that are in the care, custody, and control of the Judicial Department, who have substance use issues and need temporary transitional housing assistance, along with the necessary coordinated services to allow them to reintegrate into our communities. This is a brand new initiative at all levels, and we are happy to partner with our COC brothers and sisters and our sister agency at CSSD. That's the long and short version. We do intend to use the program for the majority of the eligible activities that are listed in the federal regulation. Those include public facilities and improvements, acquisition of real property, lease, rent, utilities, rehab and reconstruction of single unit residential, rehab and reconstruction of multi-unit residential, rehab and reconstruction of public housing, disposition of real property, clearance and demolition, relocation, and expansion of existing eligible activities not normally eligible under CDBG, which is new construction. All of those are potentially eligible activities under the state's RHP. However, we have excluded a couple of those relative to priority. We will be prioritizing the following activities: public facilities and improvements, acquisition of real property, lease rent utilities, rehab of single unit, multi-unit, and public housing, disposition of real property, clearance and demolition, relocation, and new construction. We've only excluded, or not excluded, we're not prioritizing a couple of those activities simply because the COCs have not indicated any interest or need in those particular activities. Any questions or concerns about the Recovery Housing Program action plan itself?
May I?
Joanne.
Okay. So again, apologies that I didn't take a perusing before this, but just off the bat, I thought perhaps it had something also to do with COVID recovery, but I'm understanding that it does not.
Correct.
Okay.
However, since you asked the question, the Director of Housing and Community Development, Miguel Rivera, is here on the call, and I was remiss in starting my remarks before I let them introduce themselves. So if we can, Miguel, Steve, and then Laura. Thank you. Introduce yourself, Miguel.
Oh, I'm sorry. Hi, I'm Miguel Rivera. I work with the Community Development Block Grant, so I'll be providing the administrative oversight and support with my team on the project as we move forward.
And my name is Steve DeLell. I'm the director of the Individual and Family Support Program Unit at DOH, and we manage a lot of the response to homelessness as well as some of the service ends of this. So my role in this project has really been to try to connect with our sister state agency, the Department of Mental Health and Addiction Services, to see what their needs are, as well as with another sister agency, the Court Support Services divisions of the judicial branch, to work with folks that are currently on probation, housing unstable, has substance abuse disorders, to make a potential program out of this. So I kind of pull those service pieces together and try to get a program up and going.
Thanks, Steve and Laura.
Hi, and I am Laura Watson. I am an economic and community development agent at DOH, and I work with Michael, helping him to prepare a lot of these plans that we submit to HUD to receive our funding.
Thank you, Laura.
Thank you.
So the long and short, that's this plan. I know you had another question about the affordable housing, municipal affordable housing plans, and we could certainly talk about that as a separate conversation right now or today.
That's fine.
Any questions about RHP itself?
So how does this funding impact the municipalities? Do they have specific means of helping out with the decision making on the funding, or where this funding gets sent?
Sure. So this program is actually for not-for-profits or other eligible entities, including municipalities, who can apply for these grant funds to do any of the eligible activities we laid out and create those transitional opportunities. So some communities, as an example, have a very robust internal social service organization. That is, it is actually an offshoot of the municipality. The town could apply for funds to rehabilitate or improve those public facilities. Similarly, local not-for-profit service providers who also want to be able to provide these transitional housing opportunities can apply to the department to access those grant funds to buy new housing, rehabilitate, perhaps lease housing on a temporary basis to help this vulnerable population. Okay.
Thank you. That answers my question. Yeah.
Perfect. Thank you. Steve or Miguel, any comments you want to make for the record? Okay,
I'll just say,
sure.
the goal of this funding is to provide a level of housing assistance to housing unstable households that do have a substance use disorder or substance use issues, because we realize that that can be a significant barrier to permanent housing. So by providing more options, it will only expand our inventory of housing units available to reduce homelessness across the state while providing a level of support services to ensure stability in the community.
Thanks, Steve. Miguel, anything? You're all set.
No, nothing
Okay.
for the record. Thank you very
Great.
much.
Thank you. Thank you very much. Joanne, unless you have anything else, I'm going to close this public hearing. Thank everybody for attending. And Joanne, if you want to hang on, we can talk about municipal housing plans.
Great. Thank you.
All
Thank
right.
you all. Thank you, everybody.
Thank you much. And Steve, if you can hit stop.